Okay, good afternoon, everyone. My name's Stephen Lightfoot, and I'm the chair of NHS Sussex. And it's my absolute pleasure this afternoon to welcome you to the NHS Sussex Annual General Meeting, our very first AGM, as it were. Now, we're conducting this meeting virtually, so we can allow as many people to join from across the county of East Sussex, West Sussex and Brighton and Hove as possible for this particular meeting today. And I'm going to be joined today by most of our board members. And so why don't we just do a few quick introductions so you can see exactly who's on the line today, and then we'll go through the rest of the meeting. So, as I said, my name's Stephen Lightfoot. I'm the chair of the board, but I'll also introduce Adam Doyle.
Good afternoon, I'm Adam Doyle and I'm the Chief Executive Officer for NHS Sussex.
Hannah Hamilton.
Good afternoon, I'm Hannah Hamilton. I'm the Chief Finance Officer of NHS Sussex.
Lisa Emery.
Good afternoon, Lisa Emery. I'm the Chief Transformation, Innovation and Digital Officer for NHS Sussex.
We've got Alison Cannon.
Chief Nurse.
Yeah, I think Alison, we heard that she's the Chief Nurse of NHS Sussex. Okay, and then we also have Amy Galea.
Amy Galea, Chief Primary Care Officer.
Excellent. And we have some of our non-executive directors. So we have Festina Bayo.
Festina Bayo, Interim Non-Executive Director.
Thank you for that. We've got Paul King. Paul King's our non-executive director and is the chair of our Audit and Risk Management Committee. We have Sue Marshall, I can see on the screen.
Hello, Susan Marshall, Chair of the Patient Experience Committee.
And Ash Sonny.
Hi, I'm Ash Sonny. I'm Chair of the Workforce and Remuneration Committee and Non-Executive Director.
Excellent. And we've also got, I think, online Jack Feintuck, who's our Director of Governance and Assurance. We've got Claudia Griffith.
Hi, Claudia Griffith, Chief Delivery Officer.
Tom Gurney.
Hello everyone, Tom Gurney, Chief Communications Officer.
And Mark Smith.
Hi everyone, Mark Smith, Chief People Officer.
Excellent. Okay, one of the challenges of doing these online meetings, but hopefully that gives you a sense of most of the colleagues that are with us today. We do have apologies from Louise Ansari, who's on leave. She's the chair of our Population Outcomes Committee, from Dinesh Sinha, our Chief Medical Officer, and also from our partner members as well on the board. So today's a virtual meeting, but it's also quite an important day because actually what we're going to do today is to reflect really on our first year of operation. So as many of you will recall, we started as a new organisation on the 1st of July and took over the responsibility for commissioning NHS services across Sussex from the three clinical commissioning groups of Brighton and Hove Clinical Commissioning Group, East Sussex Clinical Commissioning Group and West Sussex Clinical Commissioning Group. But I think as we reflect back over the last year, it's been really a very rewarding year to think about, and that's really what we want to do today. So if we just go on to the first slide, please, that would be fantastic. And the next one as well. So what we want to do really is then just to talk through effectively what the performance of our NHS has been in the last year, and also to think about the key achievements that we've made as well. And what we've done today, if you just go back a slide, please, Rebecca, that'd be great. Then I'm joined today by Adam as the Chief Executive Officer, Hannah, the Chief Finance Officer, and also Lisa Emery, our Chief Transformation, Innovation and Digital Officer, who you'll be hearing from later today. But I think actually it's a pivotal moment for us, as I said, simply because we've recently launched our integrated care strategy. We've come to the end of our first year, and this feels like a really good time to think about the future of health and care here in Sussex. Now, because it's a virtual meeting, we're going to have some time for questions from the public, and I'm pleased to see we've got a total of 62 people online at the moment, which is fantastic. So on the next slide, just a quick reminder in terms of how to make questions. And I'm sure you're all well aware of this, but it's really important that you keep your microphone muted throughout the meeting, and you can use the Q&A box to share any questions that you have. And certainly we'd be happy to make some time at the end of the presentations to be able to hear what's important to you. So that's the intent as far as that's concerned. Now, if we just go on to the next slide, please, that would be great. Then we do need to formally note the last year's meetings of the 3 Sussex Clinical Commissioning Groups for 21-22. And there's a link on the screen where they can be actually seen. Now, because our annual general meeting is not a formal decision-making process as part of our governance, we'll only be noting it today, and it'll go to our next formal board meeting in public for formal agreement. So that's really just a few introductions, but let's start thinking about some reflections, please. And I think the next slide is a great place to start. And I think from my perspective, I don't want to do anything else before we say thank you. We've got to say thank you to a huge number of people who work across the NHS in Sussex, and that's some 41,000 healthcare professionals that work in every different part of the NHS here in Sussex. But they don't do it alone, because we also work alongside 46,000 social care staff in Sussex and another 20,000 people who are actually working in the voluntary and community sector organisations. And so that means there's a total of about 100,000 people who are helping and supporting the health and care of the population of Sussex of 1.7 million people. And I think that it's extraordinary. I think the work that's done is inspiring, and we don't thank our staff often enough. So I think I wanted to start by saying, before we go any further, thank you very much to all of our staff and all of their families who also support us in our work. Now, I think if we also think about the NHS, it's sometimes easy to forget just the sheer scale of the organisation that we're talking about. And I think on the next slide, just to show you a few numbers, I think it's quite extraordinary, in fact, actually. In the year of 22 to 23, so that's the 1st of April 22 through to the 31st of March 23, in Sussex, the NHS services delivered over 10 million GP appointments. We delivered over 1.5 million COVID and flu vaccinations. There are over 700,000 attendances at our accident and emergency units. Over 200 people were seen per day for day cases for elective care. There was another 32,000 that had planned care involving a stay in hospital, and nearly 30,000 were supported by our urgent community response teams in their homes. So I think just the sheer scale of this is just immense. And that, again, I think with all the challenges that the NHS faces is just remarkable. And that's why I think the thank yous are just so important to say. Now, I think if I just also reflect personally on the last year on the next slide, if that's please, then I think it's really clear to say that I'm really, really proud of what we have done in what's a relatively short space of time. And I think what we've done is actually really to navigate our way through some rather challenging times. We've been through a very difficult winter in that particular period. There's no question of that. There's been multiple periods of industrial action that started at the end of last year. And obviously finance has obviously also been a challenge for us, and you'll hear more about that in a moment. But we shouldn't underestimate the positive things that have also happened. It's not just about delivering those remarkable numbers in terms of services provided, but I think as a system, we've really come together really very well. And I think there's been such a strengthening of partnership working. It's actually quite remarkable, not just between the NHS organisations and not just between NHS providers and our primary care colleagues, but also across our local authority colleagues, also our voluntary community sector colleagues, and also education partners, and many more besides. And it really feels that actually that the new structure that we put in place has given us an opportunity to come together in a much more productive way. And I think that's led to the production of our strategy, Improving Lives Together. And that was a very, very clear ask of us when we were created on the 1st of July, was by December last year, we needed to have a strategy. Now, our strategy in truth was probably more of a strategic vision, but what was then really important is actually spending the time to develop a shared delivery plan to make sure that strategic vision could be enacted. And this particular document that many of you will have seen before online, but we can't see that too well on the screen, but actually it is really vital, because that's really our roadmap for the next 5 years of how we want to transform health and care services. So again, this could not have been done without the commitment of our partners, and I'm immensely grateful for everybody's support and involvement in getting to that. Now, I think obviously we also want to talk about in more detail some of the achievements of the last year. But before we do that, what I'd like to do is just to have a look at a short video to show really the impact that our services have had on local people. So if we can play the video now, please, that would be great.
On the 1st of July 2022, NHS Sussex launched as a brand new NHS organisation to lead the improvement of health and care services in Sussex.
I can point to so many things that I'm really pleased about. How we managed a really challenging winter, how we've come together to get better primary care access, the things we've done to reduce people waiting out of area for mental health placements. Thank you for everything you're doing.
We've been working hard to improve local health and care services with a focus on addressing health inequalities. We've launched new community diagnostic centres across Sussex, established urgent community response teams to support people at home, became a discharge frontrunner and opened discharge lounges in our hospitals, and increased access to cancer screening with targeted lung health checks in Brighton and Crawley.
For NHS Sussex, this year was a really important one as we started to build relationships with the wider provider network of primary care clinicians that exist within our system. And it has been great to meet the dentists, the community pharmacists, and also the optometrists that make part of this wider primary care family, and with whom we're going to start building plans for how we improve access to primary care services.
We have also worked with our system partners on a number of large developments, which will mean real benefit for local people, including improvements to cardiology and ophthalmology services in East Sussex, and a public consultation to improve stroke services in West Sussex. There have been a number of challenges this year, and winter in particular was challenging, but we focused on how we could make sure people could receive the best possible care in the most appropriate place. Whether this was making sure people had their winter vaccinations, launching virtual wards, a new service to support people to stay out of hospital, or recruiting to new roles within primary care to improve access for local people. We also supported the health and care system through 9 days of industrial action. In this time, we also worked with our health and care partners to develop our 5-year strategy, Improving Lives Together. It sets out our ambition for the population of Sussex and how we will work together to improve lives across our communities.
The Sussex Integrated Care Strategy is really our 5-year plan to improve the health and care services for the 1.7 million people living in Sussex. This has been done collectively, not only with the individual parts of the NHS, but also with our 3 local authorities, alongside our universities, voluntary organisations, community organisations, and a Health Watch, in addition to over 3,000 members of the public who've contributed to the development of this plan.
Listening to our population is vital to our work, so this year we've been making sure that we continue to do that by recruiting a range of volunteers, including youth ambassadors. We've also conducted 32 surveys, commissioned 16 VCSE organisations to reach more marginalised communities, attended over 80 events, forums and groups to gather insight, and launched a diabetes patient network. Through all of this, we've focused on how we can work best as an organisation, supporting our people and focusing on leadership and development. This has included celebrating Black History Month, launching our anti-racism statement, and establishing a range of staff-led networks.
It has been a great year establishing the network, amplifying the voices of our LGBTQ+ colleagues through support from the organisation and our executive team, alongside working in collaboration with our system partners.
At the end of 2022 to 23, our focus is on developing a 5-year improvement plan with our partners to bring our strategy to life. And we know through this, we can improve lives together.
Well, thank you, team. I really appreciate that, and a really proud moment, I think, just to reflect on those particular moments. So let me hand over now to our Chief Executive, Adam Doyle, just to give you some more detail on some of the achievements over the last year. Adam, over to you.
Thank you, Stephen, and thank you all for joining us today. So our focus this year has been ensuring safe, high quality services amidst significant demand on all areas of health and care. As Stephen has outlined, continuing the restoration of health services following the pandemic, with specific attention to addressing health inequalities and looking to the future by working with our partners in Sussex to set out the long-term ambitions for our population through our strategy. We've never had a 5-year strategy across the health and care system within Sussex, and we're all collectively proud of that joint commitment across our multiple partners so that we can change how our staff and services work to address the challenges we have and make services better. We cannot do everything straight away. Some things take time to progress, change and improve, which is why it's so important we've got a clear plan for what we'll do today, what we'll do tomorrow, and what we'll do in the long term. And Lisa, as part of our team, will share more about our future plans later on today. There have been real challenges. Health and care services across the whole country have been under increasing pressure for many years due to the growing numbers of people needing help with them. The winter was one of the most difficult in the NHS, and this has meant that not everybody has received the right care at the right time or in the right place. We recognise that and have put things in place to have a more stable winter as we go forward in the coming months. But a lot of work has taken place across services to manage these pressures and ensure local people continue to receive safe and high quality care that they need. Additional measures were put in place across the Sussex Health and Care organisations over an incredibly busy period over the last new year, which helped us to ease a lot of the pressure in early 2023. And we agreed to focus on making immediate improvements in 4 main areas. The first, improving our response times to 999 calls and reducing the length of time people waiting in A&E. The second, reducing the variability of access in primary care and increasing access to a population. The third, reducing diagnostic and planned care waiting list. And the fourth, accelerating patient flow through our system and discharging people home where they need to be. I'm really pleased to say that in all those areas, significant progress has been achieved. But we need to continue to accelerate that progress further. And these are areas that we'll continue to focus on a day-to-day basis, while we also look to maintain and improve other key services like mental health and community-based care. But also, before we look ahead and we look at what we've done in these particular areas, it is also important to recognise the significant challenges we have faced as a system. We know that health and care services across the country have had a significant increase of demand that they've got. But also, it's also important that we recognise the uniqueness of Sussex. We have a growing and ageing population in Sussex that mean more people than ever need access to support and care. We need to carry on reducing a significantly long waiting list for planned operations that built up during the pandemic and continues to grow. We do have a shortage of staff in a number of areas, but also some specialist skills we need to make sure we can get everything done. And importantly, we have to focus on what are the key things that prevent people becoming ill in the first place, and to reduce the big differences in health that exist across local populations, particularly where people are most disadvantaged. And whilst navigating one of the most challenging winters yet, we've also had to navigate multiple periods of industrial action across ambulance staff, nursing staff, junior doctors, consultants, and as colleagues in my team are aware, these continue and we continue to manage that. We also have responsibility to make sure we spend the tax-funded system well. And our finances, we are proud of where we've got to. We had significant inflationary pressures throughout the year. We had to deal with the significant issues that cost of living created and the costs associated with delivering additional activity in acute and mental health settings. And that meant that the NHS Sussex organisation managed to break even, and Hannah Hamilton, our Chief Finance Officer, will talk to that later on. But our system managed to reforecast its deficit to 15.1 million, and I'm pleased at the end of the year we managed to bring that in slightly below that to 14.67 million. Our job is to manage and mitigate these collective challenges. And our board today talked about how we manage the competing pressures of improving quality for our community, of responding to the performance challenges that we've got, of really working closely with our workforce, but also making sure that every penny that we spend is targeted to patient care. Our improvement priorities, we've really been clear. We want to make sure what are the things that we can therefore improve immediately. And our emergency services, we really keen they focus on helping people who need their help the most. And this is really clear this year. We've done lots of work and many initiatives, but we're really pleased that our virtual wards were set up at the end of last year. And already hundreds of people who would have been in a hospital bed are now being supported by that. And further to this, in the last 12 months, our urgent response teams across the community have cared for just under 8,000 patients, which have prevented them from needing to stay in hospital. And they've also cared for the same number when they've left hospital too. Before these services were in place, we really would have seen these people being in the wrong care setting, but we know we want to build on this now so we can get more people cared at home with the services that they need. We've also commissioned support services within people's homes to prevent them being admitted to hospital. And we know that a number of people lead complex and challenging lives and often can consume quite a lot of healthcare. So in working with different population groups, we're starting to see a reduction of people who've used a lot of healthcare over the last year by giving bespoke packages to work with them. GP services have also been a key area of focus. We have heard significantly from a number of you that we want to see a GP much quicker. But it's also really important to recognise the primary care services in Sussex are working incredibly hard. And in January 2023, it was clear that we see roughly about 1 million appointments per month. And that was a rise and just under 100,000 from the previous month. So we're working really closely with our primary care colleagues for how they can get access better, but it's also important that we recognise their significant hard work they've been putting in. I mentioned earlier about people waiting on a waiting list for care, and a lot of work has taken place to address the backlog during the pandemic. And our Sussex NHS organisations have worked really closely together with the independent sector to provide additional appointments and treatments. We've also been working closely with Queen Victoria Hospital to provide more care as a cancer and elective hub. And this also remains an initiative we're going to build on through the coming years to make sure we can get people seen in the most appropriate way. It's really important that we get people diagnosed quickly. And we launched 5 community diagnostic centres across Sussex, and we're really pleased by the progress they've made. And they provided over 100,000 additional diagnostic tests for our community. And we're opening more as we go forward, and we're really trying to ensure that people are seen really quickly to therefore get the care they need. I've also mentioned that at times across our health and care system, we've got significant challenges when it comes to discharging people to the right care setting. There are many reasons for that. One can be their personal situation, the suitability of their place or residence, and also their need for greater social care support. And we've increased the availability of packages of care, working closely with our local government partners, and also used some national funding to open up a number of different routes. For example, our discharge lounge at Eastbourne District Hospital. I'm also pleased that Sussex was selected as one of the 6 areas to become a discharge frontrunner. That will give us the funding and the ability to think very differently for how we therefore get people home and get the right care for them. One of the key elements of the Integrated Care Board is to look across the 1.7 million people that we have a responsibility for their healthcare and consider who have access to that in an equal or unequal way. And we see addressing health inequalities as a key focus of our overall plan. Over the past year, we focused on 3 programmes of work across 3 of our places. In East Sussex, the Hastings and St Leonard's Universal Healthcare Programme has brought together professionals and members of the community to co-create small-scale initiatives to improve how we can get access to primary care, and also to co-design the right solution for our communities. What I've learned in my time with you all is that our communities often know the right solutions for them, and I'm really pleased by the work we've seen in Hastings and St Leonard. In West Sussex, the Crawley programme has really taken forward the development of our integrated community teams. And that programme has been at the heart of developing what is the right model of care for that community. The Crawley community, for those who are on the call, are a really vibrant community who give us lots of challenge about what services they feel should be in place. But I'm really pleased that we're starting to look at an urgent same-day primary care model. And also we're tailoring our national community hub for maternity services to make sure it feels like a multidisciplinary team in the heart of Crawley. Each of our populations are different, and the privilege of leading a system of our size is we have to look at bespoke and different solutions. And in Brighton and Hove, we're working for a different programme, which is looking at what we call multiple compound needs, people with many challenges about how we can therefore help them navigate the health and care system. And we often find that people who may have experiences of homelessness, substance misuse, mental ill health, or adverse childhood experiences find accessing health and care solutions quite challenging. And the work we've done with them is to really design what is the right model where they can access care in the right shape. So there's quite a lot I've said. And every year you take this opportunity as a chief executive to look back on the last 12 months and look ahead. And we've done some things really well. There are still some significant areas we need to improve, and our board today talked in detail about what those areas need to be. It has been an incredibly challenging period, especially through the last winter, but I do want to take the opportunity to thank everybody today who works across health and care in Sussex. There are people today, while I'm speaking to you, who are busy working with our communities to keep them healthy and well. And I think it is important that in a time when things feel challenging, we recognise that people go above and beyond every single day. For the health and care workers that watch this either now or are watching it later, personally, I want to thank you for everything that you do and keep up the hard work. We will continue to work with you to improve services. And with that, I'll hand over to Hannah Hamilton, our Chief Finance Officer, who will take you through our accounts. Over to you, Hannah.
Thank you very much, Adam. So I'm Hannah, Chief Finance Officer. So I'd like to talk to you about, first of all, how we spent your money last year. So really pleased to say that in the last year, in the 9 months of the ICB, we delivered a 277k surplus position and met our running costs target for the year. So the chart on the screens here shows how our 2.9 billion expenditure was shared across the services that the ICB commissioned for those 9 months. So you're looking at the summary on here of what we spent our money on. You can see that 48%, so just under half, is on hospital care. And the other services which we spend a large proportion of our money on include primary care, so being GP services, pharmacy, optometry and dental, it's 13%. Community services that allow people to be treated closer to their own homes, 10%. Prescribing, which is all of the medicines and treatments prescribed to people living in Sussex, is 8% of our budget. And mental health services, which includes services focused on identifying those who are struggling with mental health issues and preventing them going into crisis, as well as those who need urgent help. That's 10% of our budget. I'm pleased to say that the accounts for the ICB have now been formally audited and approved. The completion certificate has now been issued and all closed off. This might seem like a small task, but it's actually a significant challenge for the finance team to complete and close the accounts, which this year were for 4 organisations. So that was for the 3 CCGs and the ICB. It's a real credit to the team that we've had such positive results, the financial statements and the accounts. And I want to say a big thank you to the finance team for all their hard work on this. So in terms of how we worked last year, 22-23 was when NHS England started to unwind some of the novel finance regime that we had during COVID. During COVID, many NHS contracts continued to operate as blocks, and this continued into last year with an increased focus last year on improving the efficiency and the productivity. The CCG ceased on the 30th of June and replaced by the ICB on the 1st of July, which required the 4 sets of final accounts, but all required targets were met for all those 4 statutory organisations. In terms of the system, although all the NHS organisations in Sussex planned for break-even, We did have experience inflationary pressures and costs associated with delivering the additional activity in acute and mental health settings as we came out of the COVID period, which meant that the Sussex NHS system reforecasted in year to a 15.1 million deficit. And we ended the year doing a little bit better than this with a reported deficit of £14.67 million. I'll now hand over to Lisa Emery, our Chief Transformation, Innovation and Digital Officer, who will talk us through our ambitious plans for the next 5 years to transform health and care for the population of Sussex.
So as we've heard, over the last year, we've been working to develop our integrated care system strategy, Improving Lives Together. That sets out our ambitions across health and care in Sussex over the next 5 years. And its aim is to improve the lives of local people by supporting them to live healthier for longer and making sure they have access to the best possible services when they need them. Adam's presentation, of course, highlighted some of the many issues and challenges that are currently impacting our health and care services for our population and the services that are available to support people. This does mean that some people are not always getting the experience we all want, and staff are working hard under increasing pressure. A lot of work has already taken place over recent years to improve the support, care and treatment available and the timeliness of how people access our services. However, this has not always gone far enough in many areas, and a lot of the issues can only be resolved with greater, longer term and more ambitious change, something that Improving Lives sets together and aims to achieve. I'd like now to play a short animation that summarises what we're trying to achieve.
Sussex Health and Care, improving lives together. Our ambition for a healthier future in Sussex. More people living in Sussex now need extra support, care and treatment more often. The services currently available cannot keep up. This is causing some people to experience poorer health and delays in care and is putting staff under more pressure. Working in health and care is incredibly rewarding, and those that do want to give the best possible care in the best possible way. However, they are currently not always able to do this because of the way some services are run. Issues like housing costs and lack of training are also barriers felt by staff and students. Many of the challenges we face cannot be solved overnight. Real improvements can only be made through long-term change. Sussex Health and Care has published a new 5-year strategy which aims to help local people to start their lives well, live their lives well, age well, and get the treatment, care and support they need when they do become ill. Support and grow our workforce now and in the future, creating a more inclusive and diverse working environment. We are building on the work already taking place through the health and wellbeing strategies across Brighton and Hove, East Sussex and West Sussex. We've heard from thousands of people to help shape our strategy and set out to us what matters to them and what improvements could be made to make a difference to our local communities. We have also used a range of evidence and supporting information, and we have engaged with representatives and experts from the following: NHS organisations, public health, social care, voluntary and community organisations, Health Watch and other people who have an interest and knowledge of health and care to help shape the plan. The improvements fit into 3 areas: building integrated community teams and local partnerships in Brighton and Hove, East Sussex and West Sussex. This will help services and organisations work in a joined-up way to meet the needs of local communities. Improving the use of digital technology and information. This will join up services and help people access care more easily. Growing and supporting our health and care workforce. This will provide the support and skills needed and attract new people into the profession. By focusing on these 3 areas across health and care, we will be able to bring about the biggest benefits for local people. We want to achieve our ambition over the next 5 years. We are now developing a delivery plan across our organisations, staff and our communities to set out what actions need to be taken, how we will all work differently in the future, and how we will measure progress and success. Find out more and read the full strategy on our website, www.sussex.ics.nhs.uk/our-priorities.
So as you can see from the video and what we've been discussing
Sussex
today.
Health.
Sorry, apologies. So this just brings this to life. So to make our ambition a reality, as we've said, we've developed our shared delivery plan, and that outlines priority areas across long-term improvement priorities, our immediate improvement priority areas that Adam has covered and discussed earlier, our continuous improvement areas, and our health and wellbeing strategies at our 3 places. Obviously, it's those long-term improvement priorities set out in the strategy that will bring the greatest long-term benefit for our populations and our workforce. These include the development of integrated community teams, and that work will build on the work that Adam outlined earlier around the work in our 3 place frontrunner programmes. We will develop 16 integrated community teams across Sussex that will bring together our workforce across different organisations, working together and differently with communities to support the delivery of different way of care. We have developed a people plan for the system that will help grow and support our workforce over the next 5 years. And we're building on the significant work that's already taken place across digital technology and information to better enable integrated working to take place and improve how patients can access services and manage their own conditions. As well as our long-term ambitions, we continue to focus on our immediate improvement priorities that Adam outlined earlier on. And as well, we have focusing on continuous improvement priority areas that need to be real focus for where improvements are made. As you can see on here, these continuous improvement areas are addressing health inequalities that exist across our population by improving access to services, experience and outcomes for all those who are most disadvantaged. We need to address the mental health, learning disability and autism service improvements that we need to make. We're strengthening our clinical leadership to allow us to make improvements to both health and care services and the health outcomes of local people. And then finally, getting the best use of finances available so we can invest in services and make sure we're working in the most efficient and effective way possible. Finally, an important part of our shared delivery plan is our place-based priorities and the implementation of our health and wellbeing strategies across our 3 places, so Brighton and Hove, West Sussex and East Sussex. This allows us to focus on local and varying need across our different populations, working in partnership with our local authorities. Our shared delivery plan was developed and agreed across our health and care partners, and it responds to data, best practice, national policy and evidence. It's shaped by what we've been told by local people about what matters to them and their experience of health and care. And we will be regularly reviewing our improvement plan over the coming year and beyond to make sure we're achieving what we've committed to, and make sure we're also flexible and respond to any new issues that arise in the future. So coming on to the difference that people would expect to see, through the actions we're taking over the next 5 years, we're aiming to make tangible improvements to people's health and care services and the experience that people have of health and care. Those benefits will be varied and wide-ranging, but the key improvements that we expect everyone to experience are more people being better supported to manage their own health and wellbeing, so they can stay healthier for longer and be better supported to live a more fulfilled life and retain independence when they do become ill. More people and carers experiencing support and care that better meets their individual needs and is better suited to the community in which they live. More people having better access to services and experience, and more seamless care that is more focused on preventing them from becoming ill. People experiencing shorter waits for treatment, and Adam spoke about that. More people being cared for closer to home, and those who need inpatient care, hospital care, being able to return home quicker. For those who live in our most deprived areas and those with protected characteristics, more equitable access to services and improved experience of using those services. More people who either have or are at risk of serious illness being diagnosed, supported and cared for at an earlier stage. And then finally, more people being able to access services digitally more easily and feeling supported to use technology in the best way possible to suit them and their specific needs. I just wanted to cover partnership working in our system. So obviously key to delivering this plan will be greater partnership working across all members of our health and care system. So over the coming year, we'll be working with our partners to build on the strong partnerships that already exist. We'll be working towards building a system that allows us to work differently together in future across our 4 different levels, and these are shown here, to combine our collective energy, purpose, resource, expertise, and all the assets we already have, particularly within our communities. As NHS Sussex, we'll be working over the coming year to refocus our purpose as an organisation to support the rest of the system and ensure we're working effectively and efficiently for our whole population. And I think to recognise this will involve significant change for our organisation and staff as we look to work in the best possible way. So with that, I think I'll hand back to Stephen.
Well, thank you, Lisa, and thank you also for Adam and Hannah for your contributions too. You know, I'm incredibly proud of our first year as NHS Sussex Integrated Care Board. You know, and I think just in summary, you know, we've established a new organisation. We've really understood the challenges that we're facing. We've developed some really clear plans of the way forward to improve our health and care services, and we've achieved financial balance. That's really, I think, the summary of the year. And it's the way we've done it as well, I think, is important. We've done that through collaboration with our partners, and we've done that with extensive engagement with members of the public to really understand the needs as people see them, so that we can respond in the most appropriate way. So, as I said, I'm incredibly proud from my perspective for the first year. But obviously, we also want to hear from you. And also, this would therefore be a good opportunity, I think, just to say, if there are any questions, then please use the Q&A function to raise any questions. And I'll just check with our Chief Communications Officer, Tom Gurney, see if there are any pre-submitted questions before we move on to the live questions.
Yes, thanks, Stephen, and hi everyone. Great to see you all, and thanks for joining us. So my name is Tom Gurney, the Chief Communications Officer. I'll take you through some of the questions and answers that you may have. And we've had one pre-submitted question, and I see there is already a question in the Q&A function. For those who are not familiar, at the top of your screen, you'll see there's something that says Q&A. If you want to put your questions into there, then you can. Also, if you want to put your hand up and ask us verbally, we're happy to take verbal questions as well if you're feeling brave. So what I'll do is I'll just take you through it, and then we'll bring other colleagues in to answer some of the questions. So the first question, which I think is a really good one and relates to a particular area that we saw as part of our strategy, which is around medical records and information and data. So the question, so thanks for the question, it's anonymous, but thank you, is that the person says, if you were sent to Conquest Hospital from Rodhurst, the hospital is unable to access your medical records. You don't have a choice which hospital you're sent to. It's usually Pembury or Conquest. Could you change this, please? So I think the essence of the question is around that medical records and the information going with the person and every service being able to see that data. And I think that's a big part we're seeing, isn't it, Lisa? But Stephen, I'll hand over to you, and I think Lisa's probably the best place to do it, but there might be others who want to give their reflections from the board.
Yeah, I think that's a really important question, and actually it's not a surprise that one of our 3 key priorities in our strategy was better use of digital technology and data, which enables the more seamless approach to actually transfer of patient records. But Lisa, why don't you just kick us off with, if you like, the digital aspects, and then maybe we could pick up how that then affects the integration of services.
Absolutely, Stephen. So very much something we've heard loud and clear through all of the feedback we've had in developing our strategy and our shared delivery plan is that need to repeat your story, or to not see that records are available to across all healthcare providers and health and care providers. So that's one of the key objectives of the Digital and Data Delivery Board under the shared delivery plan, to do the work, to ensure that all of our providers across and partners across our system have the level of digital maturity that's needed to be able to share records, but then also to put in place those sharing agreements and the technology and tools that our workforce will need to ensure that patients get a seamless experience of care. So that's a very key priority for the digital and data workstream.
Okay, I think the other aspect of our strategy is also about the development of integrated community teams and actually providing local services for local people in local areas. And I think I'd probably like to bring in Amy Galia to actually just talk about integrated community teams and how that might also help in the future as well. Amy, would you like to make some comments around how integrated community teams as part of our strategy might also address the issue that was raised by the question?
Yeah, thank you, Stephen, and thank you for the question to the member of the public there. I think it's really important to make the point that if our digital infrastructure is talking to each other, and indeed we have the ability to have a workforce that spans multiple organisations, then we will by implication be enabling the integrated communities teams concept to flourish. And what we are aiming for through the concept of integrated community teams is really start to deliver services that are appropriate within the geographic footprints of our districts and boroughs across Sussex. There is recognition that in order for us to provide good continuity of primary and community care, but also to become more proactive in the care that we deliver to our population, and therefore become less reliant on the current episodic care model that we tend to support in the NHS, we will be enabling better outcomes for the population and indeed addressing health inequalities. This isn't a new concept in healthcare, but I think it's fair to say it's very hard to achieve because it does require change across a number of different health and care organisations in our system. And it also does require some decisions about which electronic systems people use in their day-to-day practice, etc., which will start to enable more joined up health and care. Some of what we see at the moment is just a product of legacy contracts, legacy programs, and that's exactly what every partner in the system has committed to address as part of this new strategy. It's not a quick fix, which is why it's a long-term strategic priority. And over the past few months, we've been doing some incredible work across a number of different organisations to start developing what the service offer for these integrated community teams and indeed our population could look like.
Okay, thank you, Amy, and hopefully that answers the question very well. I see on the screen we've got Michael Creedy who's wanted to ask a question. So maybe Michael, we could take your question.
Thanks for that. I appreciate your time. Whilst I appreciate this is doctors and nurses and support staff talking to each other, I feel that one part of the conversation that's quite often forgotten is the voice of the patient. And they, quite often when they come into contact with you, are all too ready to go, yes, he or me, I don't care what it costs. Along the way, though, including patients in that conversation and allowing them to be confident enough to be discharged at the end of the day and go, yes, I can now get back on my feet, can easily be forgotten. And what I want to hear is some sort of plan that says, how do we encourage our patients to have their own voice? How do we say, right, you've been included as part of A&E, you know, this is how the hospital works. This is how you can get a shower. These are the simple everyday things, but it's those kind of things that are based on lasting memories that people have of being brought back quite often from the brink of death. Thank you.
Michael, I think that's a really important question, and I think we can maybe look at this through two particular lenses. Maybe in the clinical setting, I might ask Alison Cannon to just say a few words about the processes that we adopt in terms of making sure we hear from the voice of the patient. But I might also bring Tom Gurney, the Chief Communications Officer, back in, because actually there's something around our community and public engagement as well. So there's two ways of looking at this. But maybe Alison, as our Chief Nursing Officer, would you just like to sort of explain how we address the voice of the patient from a clinical point of view? I think you're on mute, Alison.
Thank you. Can you hear me now?
Yes.
Thank you. Sorry. Sorry, Michael. Thank you, Stephen, and thank you, Michael, for your question. Isn't it so important that we absolutely hear the voices of people who use our services, whether that's in inpatient settings, in the community and in primary care? I think we work very closely with all care provision and also with our Health Watch colleagues and voluntary and care sector agencies to really try and understand the experiences of people who use our services. Of course, we don't always get that right, and where we hear we haven't got that right, we work very closely with organisations and departments to try and rectify that. My role as the Chief Nursing Officer across Sussex is to also speak to other Chief Nurses of our organisations and be able to share the thoughts and comments that we hear from people like yourself who are speaking up and speaking out for people. So I think it's something that we need to continue to focus on. We need to always work in co-production with people who use our services. And we also have other mechanisms, for example, surveys and things where people have the opportunity to share their experiences. But I think we all recognise that this is an ongoing piece of work that we need to really focus on. But thank you for the question, and thank you for raising the importance of the care that people experience. It's absolutely fundamental to everything that we're doing and the implementation of our strategy.
Yeah, thank you, Alison, and that's very much in the clinical setting. But Tom, just coming back to also engaging people who are not necessarily in the clinical setting, but are in our communities expressing the type of services they want. Just want to say a little bit about some of the engagement activities we've done, because we've done a lot.
Yeah, and thank you, Michael, for the question. It's really, really important. And what we try not to talk about is patient voice. It's more person voice, because it's not just about when they're a patient, it's when they're a person, about their whole life. So I think one of the big shifts in our strategy around integrated community teams is that we want to build services with our communities. And that will involve involvement with those communities and really working with them to make sure that we can shape and meet their needs in the best possible way. We have lots of ways in doing it as an integrated community, integrated care system and an ICB. Some of it is about involving people like our lived experience networks and our community ambassadors, who play a really, really important role. Others, it was we go out and actually work with people and get their views. And there's lots of mechanisms. And if anyone on the call wants to get involved in any of that, do please drop me a line and we'll share some of the details. It's really, really important we continue to work with you and all of our public and making sure we've got the best possible services that meets local need.
Excellent. Thank you, Tom. That's very helpful indeed. And thank you for the question, Michael. So we've got another couple of questions coming. So can I maybe start with Barbara Shepherd, please, if you'd like to ask your question, please.
Yes, thank you very much. It's just something you touched on earlier on. How far have you got with dentists? There's a desperate need for NHS dentists. So many of them are going private and not everyone can afford the prices. So to be able to get our NHS dental system back would be an absolute godsend for an awful lot of people in this county.
Yeah, but Barbara, that's a very relevant question actually, and certainly I'll come to our Chief Primary Care Officer Amy in a moment just to explain what we're doing in that area. But I can assure you that from a board perspective, we've identified this as a risk across Sussex, and therefore, the board itself has been looking to have action taken on this. But Amy, do you want to just explain some of the things that we're doing on this area?
Yes, absolutely, Stephen, and thank you, Barbara, for the question. You raise a really important point that we know is affecting a number of people in Sussex, but also elsewhere in the country. And I guess I'll start with the fact that we have taken on delegated commissioning responsibility for dentistry and also community pharmacies and ophthalmology as we began our life as an integrated care board, so from July of last year. And as part of that, we have been reviewing, I guess, our position as a system in relation to NHS dental activity. I guess a few things worth clarifying, because I think there are a number of misconceptions when it comes to NHS dentistry, which is NHS dentists are, like general practitioners, independent contractors, and they do operate to a national contract that many of you will have heard is under government review and reform as we speak. Currently in Sussex, we have about 80% of the NHS dental activity that we contract being delivered. And clearly there is 20% of those contracts that isn't. And there are a number of reasons why that is, partly to do with payments of dental activity, but also some issues with the workforce. So over the past few months, we've been getting to know our dental providers across the system, listening to what issues they are facing and why they might not be providing NHS dental provision. And now we are at the point where we're trying to identify solutions that start to at least deliver all the activity that we are contracting for, and then start to also improve access for the population. We will share a link to our website where we do have quite a lot of information on NHS dentistry. That website is kept regularly up to date because we are trying to constantly increase the level of commissioned activity, especially around urgent care required. So I would encourage you to just keep looking on our website for the latest updates. But this is an area that is a challenge for us as a system and also the country. And it's one that we are very much focused on, but we also have limitations around in terms of our ability to really turn the dial on this at present.
Amy, thank you. So hopefully, Barbara, I think it's recognised that this is an issue. We're doing what we can immediately, but there's likely to take some time to fully resolve the issue, I think it's fair to say. But thank you for your question. Liz Walk, I'm sorry if I've pronounced your name incorrectly, but I see you've raised a question too.
Yes, thank you. It was just a couple of things. The diagnostic centres, I don't think you mentioned where they were, where they've been placed, and also where you're intending to put them. And the other question was, are there any GPs represented on your board? That's just my two questions. Thank you.
Well, why don't I'll come to Claudia Griffith in a moment just to talk about the community diagnostic centres, but I can say, yes, we do have a GP on our board. It's Dr. Raghu Rajan, who works in the Newark practice. It's a requirement for all integrated care boards to have a general practitioner, but also we're quite unique that we also have a chief primary care officer on our board, which is Amy, who you just heard from. And also one of our non-executive directors is Ash Soni, who's also a pharmacist. So if you like, 3 of our 15 members have a primary care perspective. So I think in that sense, I do believe primary care is well represented on our board. But in terms of the community diagnostic centres, Claudia, do you want to, as our Chief Delivery Officer, just explain where our community diagnostic centres are and what the future plans are?
Absolutely. Thank you very much, Stephen. Thank you for the question. So we've got community diagnostic centres spread in a range of geographies across the patch at the moment. So we've got Bexhill, we've got Falmer, we've got Shoreham, Bognor and East Grinstead. We have further CDCs also coming online, planned in Crawley and Chichester as well. So we have a significant amount of additional capacity that has already come online in terms of the community diagnostic centres, and they are seeing significant amounts of activity, with the majority of them performing well ahead of plan. So it does represent a significant step change in the amount of diagnostic capacity that we have available to the population of Sussex. And we're really pleased with the community diagnostic centres and that they bring those services much closer to the people that we serve. They provide an increased level of accessibility, and it aligns really well with the strategy of the system overall around trying to improve accessibility and, as we say, bringing care closer to the patients. I noticed that there's a couple of requests in the chat box around wanting mobile diagnostic units that have been put in there. I think it's important to note that having the workforce in the right places is really important, and having the critical mass of workforce available to us is really important. So for that reason, that is part of the thinking around how do we consolidate the right kinds of diagnostic testing and capacity in places that make sense to local communities, but with enough scale and scope to be able to do that really efficiently and make good use of funding as well.
Okay, thank you, Claudia. You know, and obviously the community diagnostic centres are in addition to all the other diagnostic services that were in existing hospitals too. So, you know, this genuinely is very helpful additional capacity. And as we know, early diagnosis to get on the right path for treatment as soon as possible will improve health outcomes. So that is excellent. Okay, I can't see any more questions on the screen, but Tom, can I just check if there are any more in the chat function that have been raised that you want to reference?
Yes, there's been a few questions coming in, Stephen. So I'll just pick a few out. So firstly, there was a comment from Michael around, are we going to post this AGM online? Yes, we are, because we're recording it, and so we will be posting it online so you can watch it back, and for anyone who hasn't seen it. There has been a question from Sally Ann Hart. So thank you, Sally, for joining us and posting the question, which is ESHT, which is East Sussex Healthcare NHS Trust, and the ICB covers a wide range of challenges. Hastings is a coastal community, which was a case study in the CMO report, which is the Chief Medical Officer report into health and coastal communities in 2021. One of the most important things that healthcare trusts can do in more deprived coastal communities is to provide accessible and comprehensive healthcare services. What outreach and health education is taking place? And then just picking up on Claudia's point around possible for a mobile diagnostic unit.
Okay, I think there's a number of components there, but you know, obviously our Chief Medical Officer isn't with us today, but maybe Adam Doyle, I can maybe bring you in terms of just to talk a little bit more about Hastings, because you referenced that in your earlier slide, and maybe other colleagues be able to add some further colour. But Adam, do you want to explain about what we're doing in Hastings?
Yeah, thank you, Stephen, and nice to see you, Sally Ann. So a few things for us. So if we go back to what Lisa covered, which was our integrated care strategy in general, which is about 16 integrated community teams, that is how we're aiming to look at how we bring together health and care across the system. And our very strong engagement with our communities, I'll come to what we're doing in our coastal areas in a second, was that people wanted us to arrange services around where they lived and what made sense to them. Now, that is quite a different construct from how sometimes NHS services have historically been configured. So people say to us, well, I know my local voluntary group, I know my local district and borough, I know my local community. So what we're aiming to as part of this 5-year strategy is reorientate all of our NHS services that make sense around that community. So therefore, we've got 16 different health and population profiles we look at now. So if you live in Chichester or Hastings, the healthcare solutions are fundamentally different due to the affluence, due to the starting point, due to the poverty levels, due to the demography of the population. So what we're aiming to do across the health and care system is say, no matter where you live in Sussex, this is the core offer you should expect to receive. And we think that's a universal offer regardless. But then in different communities, there will be different solutions that we need to put forward. So, for example, the programme that I spoke about in Hastings and St Leonard's is about a wider universal healthcare offer for the populations of Hastings and St Leonard who historically have not been well served by health services, or where we have at times asked them to come to us rather than be where they are. And in working with, for example, Hastings Borough Council in the vaccination programme, we were able to put in very different health and care solutions by co-producing that with the communities that live there and also with the Borough Council. And what we have to do as a health system is be slightly more humble about recognising what we don't know and asking people for their advice. So in coastal communities, what do we see across our patch? We do see a higher level of unemployment. We see a lower level of educational attainment. We see other multi-compound needs that people have, which point to poverty, point to housing, point to exercise, point to employment. And our job as an NHS is to lean into those sectors to say, what can we co-produce with you in the community for a different solution? I'm really pleased we've got a prototype in Hastings and St Leonard that we want to talk to the community about, but we have just developed that with them. We have to now, over the next 12 months, kind of settle on a model with that community and therefore be really held to account for how we take that piece forward. The challenge we have as a health and care system with the current funding arrangements we've got, we would love to be able to put lots of bespoke services with lots of workforce in the community. But Sarah, you're aware, I've also got to make sure that I make the budget work as well for our system that I'm allocated from government. And therefore, sometimes we're just not able to either put everything where the population would want it, but where we can't, we've got to make sure we create an accessibility for the population to get there, whether that's from travel or different arrangements to make that happen. So that's kind of the approach we'll take. And I've taken it very specifically down to Hastings and St Leonard's. But if we were speaking to different communities, we'd have different solutions going forward. And that will take us a number of years to get there and will require significant change of our healthcare organisations to work in that way. But it's what our population have told us. And also we've compared this model to all the best international models of healthcare. These kind of solutions work. So it's very exciting, but there's a lot of work to do to get everybody in that space. But we feel confident that we can therefore do that.
Great, thank you, Adam, and that's why I think actually the sense, because I think there's just a natural synergy there for us to work, more collaboratively with local government. Okay, I know there's another question on the chat function. Tom, do you want to just choose the next one, then we'll maybe go to Lillian?
Yeah, thanks. And I think there's a few questions here, and hopefully I think we've covered off Daniel's point around how we're working closely and closer with our integrated community teams. There's a question here about working with our voluntary and community sector, which I think is a really important one, and it's something that we are really looking to strengthen. So the question is, as a voluntary organisation supporting people with dementia and their family care partner, we have been able in East Sussex to raise concerns with the dementia support team with consent. Do you see the voluntary sector being able to do this across the board? That's from Jenny. So Jenny, thanks for your question.
Thank you.
Okay, so well, first of all, Tom, do you want to just quickly explain what we do in terms of engaging with the voluntary sector, and then maybe I'll come to Claudia in terms of how we potentially commission services that could involve the voluntary sector too.
Yeah, so we've got a really good relationship with the community voluntary sector, but I think we recognise that it can be strengthened further. What we're trying to do is really make the voluntary sector a key, what we might call a strategic partner. So they're round the table and they help us in our decision making. There's also an element where we commission the voluntary sector because they are a key provider, as people know, and then we work in partnership with the voluntary sector, and that's particularly really important in terms of some of our engagement work we do, because we know going through the voluntary sector, that is really how we can get that really granular engagement. So we work with the voluntary sector over lots of different areas and lots of different ways, and what we want to do is strengthen all that. And so that's what we're doing in terms of the engagement side of things. But I know Claudia's been having a lot of conversations, particularly around the commissioning side, to strengthen that partnership. So Claudia, can I just give you what we're doing about that?
Thank you very much, Tom, and thank you for the question. So yes, the voluntary sector is an absolutely key partner for us in health. As Tom described, the voluntary sector have incredible links into local communities and into patients and their families, and are a vital source of information and support as well. We recognise that the NHS can be tricky for the voluntary sector to deal with in terms of the difference in size sometimes, and that can make it engaging around commissioning and some of the offers that the voluntary sector can provide can be quite challenging. So there is a huge amount of work going on looking at how we enter into a more collaborative arrangement with the voluntary sector, looking at how we support the voluntary sector to come together to give the voluntary sector the sort of scale that enables them to engage, I guess, in an easier form with the NHS, so that when we go out to commission various services, voluntary sector partners can come together in a different way and consider what their offer to the NHS can be and how we can come to I guess, how we can make that process more straightforward. But there was a huge amount of work that we've done with voluntary sector, particularly over the course of the pandemic, where the voluntary sector are able to step up and provide support to some of our most vulnerable communities at pace. And it's vitally important that we continue to build on and strengthen those relationships.
That's great. Thank you. And I've got to say that the voluntary community and social enterprise sector, we really value the alliance we have with the VCSE Alliance. That's really important to us. We've also, on our Sussex Health and Care Assembly, have got 3 VCSE members on that, because we really want to involve the voluntary sector in terms of the development of our strategies. And I really think that the integrated community team model will actually work in the VCSE favour as well, because I think actually breaking down Sussex into 16 integrated community teams, it's a smaller unit that will be easier to navigate and easier to connect with. So we're really committed to this, and there's no doubt, as I mentioned, there's some 20,000 people working in the voluntary sector in Sussex, in what best part of 6,500 organisations. So it's really important, and we want to work with you, I think is the message. Why don't we just move on to Lillian Bogue. Hello, Lillian. Nice to see you again. You have a question for us. I can't quite hear you yet, Lillian, but hopefully I can see you now.
Mine is about the community diagnostic centres.
Okay.
You've got a whole population in the middle of West Sussex who are going to need to travel to a diagnostic centre, but they could pass the hospital that they are going to have their treatment or the thing to get to the diagnostic centre. So I was wondering if there's any way they could go to the nearest community diagnostic centre, but have their treatment in the hospital that they need to go to. I mean, if they were networked, once you've got your diagnostic, you could then go to the hospital that you wanted to go to or that was nearest to you to go to. But otherwise, you could be travelling past a hospital to get to the community, which seems to me to be a bit of a waste of petrol.
No, I definitely understand the issue you're describing, but maybe Claudia, can you describe how the community diagnostic centres will work with our hospitals to avoid unnecessary travel for our patients who need them?
Absolutely. So they will be networked. So the hospital where you can receive your treatment will be able to access your diagnostic results from the community diagnostic centre. So it shouldn't matter where you have your diagnostic done in terms of then where you have your treatment done.
That makes much more sense than what I. Thank you.
Yeah, no, that's very much part of the plan, is to integrate our services, and that includes the community diagnostic centres. But Barbara Shepherd, I see you want to ask another question, then I'll come back to Tom if there's anything else on the chat.
It's going back to what you were saying about having different types of communities in Sussex. And I can see that completely. Although we come under Chichester District Council, we're Selsey and we are classed as an isolated community. And basically, it's elderly. It's spot the person under 65 in Selsey. So obviously we come into that category as opposed to Chichester, which is a younger population and more vibrant. So are there any plans that we can actually sort of network with other similar communities? Because I know we've got an absolutely brilliant system in Selsey called the Community Forum, which I think is held up as a model and is being expanded to other isolated communities. But it would be nice to be able to, albeit on the patient group level, being able to network with other similar communities that we may not know where they are. would that be something to take on board, because we can share ideas?
Yeah, I think that's a really interesting idea, Barbara, is my initial response to that. And certainly in each of the integrated community teams, there's going to be a range of population right across the age bands, because every area will have, people at the youngest end, the people at the working age, and then people at the oldest end as well. And in each of the community teams is going to need to respond to the numbers of the population in each of those groups. So I think, just because it's either a young population or an elderly population predominantly, we still have to provide services to all the population. So I just want to make that particular point, but maybe bring Amy back in just in terms of the sharing of learning across the integrated community teams. We're still at the early stages, that we've still just identified what the footprints are, but the ways of working have not yet been established. But it seems like an interesting idea, Amy. What do you think?
Well, I think Barbara makes a very, very important point and highlights the fantastic opportunity that we have in Sussex in terms of the scale of our system and I guess our geography, because we have coastal communities, we have isolated rural communities, we've got towns, we've got cities. We have we are almost the testbed for the country in terms of how you make this work. And Barbara, absolutely, between Selsey and Wealden, there are some similar communities for whom who could learn a lot from each other. And actually, the reason why we are doing this programme in this way, although Adam mentioned the core offer, he did also say that there will be local variations, didn't he? And partly the offer might be the same, but how we deliver it to the local community might differ. And I think that is going to be the difference really here of this particular I guess, strategic opportunity that we have, because it's how we operate our services that will need to be mindful of where people live and how communities interact with each other. And that's absolutely at the heart of how this model will be built, which is why we're learning from the work done in Hastings with our community.
That's great. Thank you, Amy. Okay, hopefully that helps, Barbara. Tom, can I just come back to you and ask for any more written questions?
Yeah, there's a question from Malcolm, and apologies, Malcolm, you've been waiting patiently for us to answer this question, but it's a really good one. It's about children's mental health. So the question is, our schools are facing increasing challenges with children who are waiting for mental health services. Teachers are not skilled with mental health. And are there any plans to support teachers during this current challenge with children's mental health services? Really good question, Malcolm.
Okay, well, thank you for that, Malcolm. Maybe I'll come to Alison in a moment, but I'm also quite interested in inviting Sue Marshall, one of our non-executive directors, who chairs our patient experience committee, to maybe also comment. But Alison, I'll maybe come to you first, if that's okay, as our chief nursing officer.
Really important question. So yes, we've been doing a lot of work in the children and young people's mental health space, Malcolm, across the last 12 months, because we recognise that this is a key priority for us across health and care across Sussex. We've committed to quite a significant investment, not just in schools, but in terms of improving and expanding our specialist mental health services this year. I think we recognise the demand post-pandemic, particularly within schools, and we've increased our mental health support team offer to schools. And this has been expanded over the last 12 months to cover a larger proportion of schools. We've also introduced a single point of access in West Sussex, and we're also increasing our activity alongside our voluntary and community sector agencies as a key priority for this work. I think we also would recognise that we're seeing an increasing number of children and young people with neuro disability and neurodiversity, and we're committed to improving the access for those young people across Sussex. So there's an awful lot of work, Malcolm, that's happening in this area. I mean, Claudia may also want to say a little bit more in terms of some of the work that she and Dinesh, our CMO, have been working in partnership with our local authorities and our mental health trust across the system. But I'll hand back to you, Stephen, and you can maybe bring Sue in, and then maybe we can go to people.
I'm conscious of time. I know we've got a few more questions to deal, but Sue, obviously you chair our patient experience committee. I was wondering what sort of assurance you're getting that we're providing services, all mental health services across all age groups, but children in particular, but also adults too.
Yes, thank you, Stephen, and thank you very much for the question. Really pertinent as we face these increasing challenges with children's mental health. As chair of the Patient Experience Committee, we've taken this challenge very seriously. We received numerous reports around children's mental health services. We've had in-depth reports from our CNO and from Dinesh, our medical director, into children's service and to neurodiversity and the pathway. We constantly look at the evidence that we've got and the trends and the themes around patient experience and around children's mental health. It's one of our deep dive areas. So we'll be receiving further information as the pathways develop and as we look further into what services are being provided. So I think the message, Stephen, really is that, and Malcolm, is that it's key for us to keep looking at this area. It is an area of challenge for us and one that we constantly look at.
Okay, so I think what we'll do is we'll probably move on, but hopefully that sort of gives us sort of a sense of the importance that we attach to that particular issue. So thank you for raising the question. But just keen to make sure we answer all the questions that have been raised. But Tom, next one, please.
Yeah, so the next one's a really good question. It's something that we hear a lot that people have said when we do our public engagement, which is around additional housing and what does that mean for access to services, particularly GP services. So the question is, around West Sussex, there has been a massive building programme. Are you watching the demand on GP practices as they take on more patients? And then also related to primary care, another part of primary care is also, have you noted any problems with pharmacies accessing certain drugs due to supply chain difficulties? And if so, how can it be addressed?
Okay, well, maybe come to Amy, if that's okay, just in terms of the process we follow to because there's been a lot of house building in Sussex all over, and I know that from my travels around the county. But how do we track, the extra population and then making sure our sort of GP services meet that demand?
Absolutely, and Sussex is a very attractive place to live, is it not? That's why we're seeing the growth in population. We do have processes in place actually with our local government colleagues around how we do local planning. So local planning is a joint responsibility of local government and ourselves, and indeed other public services. And we regularly review population growth figures and plan our health services around that. Clearly, increases in population numbers does lead to an increase in the number of people who are registering to practices, and that is something that we review through the annual contracting process that we have got with general practices. But I think it's important to recognise that that has impacts on the wider health and care system as well. It's not just primary care services. So in the local planning phase, we look at that in the round, and indeed we work very closely with local government partners in West Sussex, Brighton and Hove and East Sussex on that. The other thing probably to point out around population growth is that in primary care, especially in general practice, quite a lot of work is happening at the moment to think about how to operate the front door of practices in a different way to avoid that 8 a.m. rush that many people have cited to us, but also to think about how we make the best use of the skills of the wider general practice team. So it's important to think about the estate, the workforce and the digital infrastructure in the round when we're considering these plans. Recently, we undertook a review of our general practice estate in line with population growth, and that will be feeding into a system-wide estate strategy as well towards the end of this calendar year. And then if I turn to Stephen, the second question which was around medicine supplies. I think it's fair to say that nationally in the news we've heard a lot about medicine shortages, And there, for some medicines, that has been the case in terms of our supply chain with the rest of the world. And in cases where that happens, we tend to use alternative drugs which are appropriate. And the other part of that is that in some cases, it's not having the right volumes of the right pharmaceuticals in the right places that has been an issue. And I must say that in Sussex, we have a good network of community pharmacies and indeed with our hospitals. And we have moved supplies around the system where we have needed to meet patient demand. We also work very closely with NHS England on this.
Okay, and as we have a pharmacist on the line, which is our non-executive director, Ash Sonny, is there anything else just practically? I know you don't have any pharmacies in Sussex, but practically, how do you manage medicine supply issues?
It is a national problem at the moment, but we are trying to maximise the access that we can. But what we did, this is unfortunately the problem we've had is that there's always shortages of certain drugs. It's just some of the more common ones have become more apparent more recently. So it's become more visible in many ways. But we are constantly looking and sourcing medicines, but we need to make sure also not only that we are accessing them, but the ones that we do access meet all the regulatory requirements that are put in place. And you know that also just means that we have to keep our patients safe. So there might be occasions where we will be more restrictive in what we supply. We won't supply with everything in one go, but we will make sure that we do because our aim is to make sure everybody gets enough to be able to get by and be able to get through what they need to. But it is a global problem currently. Okay, well, thank you, Ash, for that context. But also, it's good to hear from Amy around the network of pharmacies across Sussex as well. Okay, I think we've got time for one more question, Tom. So, would you like to choose wisely?
Yeah, thanks. And you may have noticed Adam's been busily typing away to answering some of the questions as much as possible. So I think we've answered most of them. I think one from Michael around how are we improving digital and data. I think we've covered that quite a lot there, Michael, but actually what we'll do is we'll share some of the real specific details we're actually doing outside the meeting. That's all right. The final question I'm going to say, which is quite pertinent to today, but something we discussed at length at the board, was around how are we able to expand on the initiatives we are taking to reduce the elective care backlog. So that is the waiting times.
Okay, so I see that Julian's also asked to put his hand up, so I might try and come to him as well. But Claudia, could you maybe just give a very, very short answer to what we're doing on planned care?
Absolutely, and thank you for the question. Difficult topic to give a short answer on, but we know that far too many people across Sussex are waiting for too long for planned care appointments. So there is a significant programme of work in place across Sussex to look at how we address this. This includes looking at how we use our theatres more productively so that we can undertake more surgical activity, how we improve our use of outpatient appointments, putting patients more in control of follow-up appointments, and that creates capacity for us to treat more new patients. We look at mutual aid, so looking at where we have capacity opportunities in one provider that might be able to help out another provider within Sussex, so how we can sort of level up the activity across the patch. We also look at how we're increasing support to primary care so that when they make referrals, they get the right kind of advice and guidance to ensure that only those patients that really need to go forward onto a waiting list do go onto a waiting list. Just alongside that, in terms of support to patients, there is a range of information on our website about patient choice. So if people are waiting for extended periods, how they can make potentially alternative choices around providers. There is also information through the national NHS My Planned Care website about supporting individuals to stay well while they wait. The final bit I wanted to touch on was a digital initiative that's coming into Sussex, where we're only one of 3 systems nationally to get access to something called My Healthcare Plus, and that will give patients a greater ability to manage referrals and understand where they are on the waiting list, but also make choices around where they get treated. So all of those interventions are designed to try and address the problem that we have with the elective backlog. Thank you, Stephen.
And I know from the Finance and Performance Committee, which I chair, also review that in detail, and so there's a lot of initiatives there. So hopefully that gives you some comfort. Julian, we've got 1 minute left, so if it's a very quick question, we can maybe take it. I'll give you the last word, and then I'll just sum up and close. Julian.
Yeah, well,
you very kindly answered my question. I was just wanting to raise the question that I'd raised in the chat. So you've answered it. So I've given you 1 minute back.
Oh, Julian, thank you very much. Sorry, I was I'm not multitasking very well here between the chat function and that. Okay, well, thank you very much, everybody, for your contributions today. We really genuinely appreciate it. I think as far as I'm concerned, then, I think I said in my summing up, we've been established for 1 year. I'm really proud of the team that we've built. I'm really proud of the organisation that we're leading, and I'm really proud and privileged to be part of the NHS here in Sussex. We understand the challenges and they're not easy, but it's not all bad news. There's a number of really positive things that we're doing to genuinely improve services. And the important thing is to have the plan and then have the real commitment across our partners and our collaborators to actually deliver that plan. I genuinely believe that. We also need the involvement of the public. Personally, I've done a lot of public engagement events and want to continue to do so. We certainly did something like 75 engagement events to celebrate NHS 75 earlier this year. So engaging our communities is really, really important and something we want to continue in the future. Certainly, if you want to get involved, there's a lot of information on our website. So www.sussex.ics.nhs.uk would be the place to go. You're very welcome to get involved. And really, let's just sum up by saying what we're aiming to achieve is to improve lives together as a Sussex health and care system. That's really what we're aiming to do for the 1.7 million people that we serve here in Sussex. So thank you very much for your time today. I hope in a year's time we'll be able to report even more progress on the things we've been talking about today. We value your support and we value your continued commitment and engagement. So on that note, I'll close the meeting and say thank you very much for your attention. Goodbye for now. Bye-bye.